Congressman Price has spent his political career opposing many of the basic federal health programs that he's now being asked for permission to oversee. He has repeatedly voted against the Children's Health Insurance Program. That's a program that provides health insurance to 8 million kids in America. We decided, even before passing the Affordable Care Act, we were going to extend health insurance coverage to children, making a real commitment at the federal level on a bipartisan basis to do it. 8 million kids are covered nationwide, 300,000 in Illinois. Now, Congressman Price has spent the last 6 years in a desperate attempt to repeal the Affordable Care Act, Obamacare. If he were successful in an effort, it would eliminate health insurance for 30 million Americans and lead to dramatic premium increase for those with health insurance. Last year, it was Congressman Price of Georgia who authored the Repeal and Retreat Reconciliation Bill that, thank goodness, was vetoed by President Obama. Bound and determined, Congressman Price was to eliminate Obamacare. Did he have a replacement? No. And for 6 years, the Republicans have never had a replacement. That's why they're changing their rhetoric. It went from repeal to repeal and replace, and now it's repair. I can't keep up with them, but I will tell you, starting with repeal is inviting a disaster in health care in America and calling into question the health insurance coverage of 30 million people in our country. So if Congressman Price had his way, it would mean less funding, fewer services, fewer people covered. In addition to wanting to repeal our health care law, Congressman Price wants to fundamentally and negatively change Medicare and Medicaid. Those two programs together serve about a third of the people living in America, 120 million. He wants to eliminate the Affordable Care Act's expansion of Medicaid. Repealing the Medicaid expansion that I mentioned earlier would put 650,000 Illinoisans out of insurance, and our state would lose $37 billion in federal funding over the next decade. Now, what impact does it have if a person shows up at an emergency room sick with no insurance? In America, that person still receives care. But who pays for it? Everybody else. People with health insurance end up paying for those who receive care and don't pay for it. Medicaid makes sure that that hospital receives a payment. So when Congressman Price wants to eliminate the coverage of Medicaid under the Affordable Care Act, it means less money coming into the hospitals across America. Some hospitals are big and prosperous and they can take it. Others cannot. In downstate Illinois, where I hail from, small town America, hospitals in those communities losing the Medicaid, which Congressman Price would eliminate, are going to have a tough time staying open. The Illinois Hospital Association tells us we will lose 90,000 jobs if Congressman Price's plan to repeal the Affordable Care Act goes forward. 90,000 in Illinois. And I needn't tell you that they are the best paying jobs in downstate communities. So it's a job killer, and sadly, it endangers the health of the people who count on these hospitals. What is he thinking? He's a doctor. He should be thinking in terms of what it means when you don't protect people with basic health insurance. Right now, if you qualify for Medicaid, you're guaranteed to get health care. Under Congressman Price's plan, the man who wants to be head of Health and Human Services, the guarantee is gone. Illinois would have lost $14 billion in Medicaid funding if Congressman Price had his way. Faced with far less federal funding, the states would have to be forced to find ways to save money, even worse than what we currently have in our state. They might start Medicaid waiting lists or work requirements or cut benefits. Think about it. A person nominated to lead the nation's premier health agency supports proposals that would take health care away from people. It gets worse. Congressman Price wants to privatize Medicare. Be careful when you hear a politician stand up and say, I want to guarantee your access to health insurance. Well, I have access to a lot of things. I can walk onto the showroom floor of people who are selling $85,000, $95,000 cars. I mean, I have access to those showrooms. Can I buy one of them? No, I can't afford it. Most people couldn't, but I have access to it. So when they say you have access to health insurance, the obvious next question is, what kind of health insurance, and how am I going to pay for it? Watch out for that word access. It is a loaded political word. Just the other night, there was a debate, you might have seen it. My colleague Bernie Sanders was debating Senator Ted Cruz of Texas. And darned if Senator Cruz didn't come up with that word saying, we've got to make sure every American has access to health insurance. Nope. We've got to make sure every American has health insurance. How about that? Health insurance they can afford that is worth buying. Congressman Price wants to privatize Medicare. So instead of having a government-run program for tens of millions of Americans, he wants to put the seniors and disabled in America back in the loving arms of health insurance companies. How about that? Do you remember a time when you or your family was on the phone with somebody begging them for health insurance coverage, waiting and waiting and waiting for your turn? That's what he thinks is access, and that's what he believes is good health insurance. I don't. Ending the guarantee of Medicare for hardworking American seniors and handing them a voucher and wishing them good luck on finding their own insurance, that may be access, but it's not protection. The point of voucherizing Medicare is to save the government money by forcing seniors to pay more out of their own pockets. That is Congressman Price's approach, and now he wants to head up the agency in charge of Medicare. Don't take my word for it. As he said, nothing has had a greater negative effect on the delivery of health care than the federal government's intrusion into medicine through Medicare. Since 1965, when we created Medicare, listen to what's happened. Before Medicare, 51% of Americans 65 or older had health care coverage, and nearly 30% lived in poverty. That's before 1965. Today, 98% of seniors have health care coverage, primarily because of Medicare. Fewer than 10% live below the poverty line. It's made a dramatic difference in their quality of life and the length of their lives and the independence that they enjoy in their lives. In addition, by ensuring access to care for more people, Medicare has contributed to life expectancy, 5 years higher today than it was in 1965. So Medicare has helped ensure more seniors have health insurance, fewer seniors are living in poverty, and people are living longer. Is that what Congressman Price considers a negative effect on the delivery of health care? There are so many different issues where Congressman Price has taken what I consider to be radical and extreme views, particularly when it comes to health care. I won't go through the long list, but I will tell you this. We debated the future of Medicare when I was a member of the Simpson-Bowles Commission. We were looking at the deficit situation facing our country and looking, as we should, at entitlements. And many of us said at the time, be careful about raising the eligibility age for Medicare. For a congressman or a senator, a couple more years at a desk before you qualify for Medicare is not a big ask. But if you happen to be a waitress on her feet every day, suffering from arthritis or some other issues, 2 more years in the workplace literally are backbreakers. And if you happen to be driving a truck, making deliveries, changing the Medicare eligibility age from 65 to 67 or 70, that's when you're going to get in trouble. That's when people really are going to face a hardship. Sadly, Congressman Tom Price of Georgia doesn't get it. He doesn't understand that part of it. And because he doesn't, I'm going to be opposing his nomination, watching carefully and closely. There's going to be a battle royal on the floor of the House and the Senate about funding important programs in America. Department of Defense, as important as it is for America's security, wants all the money it can get its hands on. And I want to make sure we always spend enough to keep us safe. But the battle is going to be between defense and non-defense. Non-defense includes health care. Non-defense includes medical research. Non-defense includes education. So now we're going to have someone here at the Department of Health and Human Services who sadly is not committed to the basics of Medicare and Medicaid. That is not good news for seniors and disabled people across America, and that's why I'm going to oppose Congressman Price. I yield the floor.